Welcome everyone, and a very good day, evening, afternoon, midnight to everyone. I'm honored to welcome you to this storytelling session, making the first line of defense accessible to furthest behind. My name is Sara Ahrari, and I'm Simavi WASH First Program Manager. I'm pleased to welcome you to this session where we will share the stories of those who have moved and shaken up things during the pandemic, the stories of the faces behind the mask. In this session, after this welcome, there will be opening remarks by Ariette Brouwer, the Managing Director of Simavi. Then we will hear stories from Kenya, Indonesia, and Ethiopia. These are recorded stories, but I'm also very honored and happy that we have that it has been possible for these friends, these movers and shakers, to join us live today. And after the stories, we will have a few minutes also for reflection and if there are any questions and answers. With this, I would like to invite you to listen to the remarks of Ariette.
On behalf of Simavi and other partners of the WASH SDG Consortium, I would like to welcome you to this storytelling session from our WASH First program. And we are grateful that the timely additional investment of the Dutch Ministry of Foreign Affairs in our program has helped us to promote healthy practices to prevent further spread of COVID-19. And the financial injection has helped us to raise awareness about the virus and has improved access to WASH services in 6 countries: Ethiopia, Indonesia, Kenya, Mozambique, Rwanda, and Uganda. And while implementing our program, we encountered many movers and shakers who stood up, took responsibility, and acted despite their restricted circumstances at home, institution, and communities. And these people have made a difference in many lives because doing nothing was not an option. And veiled behind their face masks, they demonstrated this despite the strong forces widening the inequality gap, the trend can be reversed and a new narrative of hope can be written. And we are not able to fully share all the inspiring stories of these movers and shakers, but I'm so proud to share with you the personal stories of Sophia, Mary, Leah, and Samuel. And on behalf of Simavi and all our partners, thank you.
I learned that virus can kill people, innocent people. When the school closed, I feel sad. I was learning at home. I miss my friends, my teachers, and learning at school and football game. I make sure all people in school could wash hands. After I got to know the importance of washing hands every time, I tell them, what is that virus? They make me to feel happy when they started following instruction because it can avoid the spread of this virus. Hello, I'm Sophia. I take action for safe water and hygiene in my school. I shake things up.
When COVID came, I felt like this is it. I have something to give to the community. My knowledge, my skills, and I knew COVID is not just about me, it's about each and every one of us. So it was a bit scaring and intimidating, but in the long run, you knew it was for a good cause. One big lesson I've learned that we have to embrace diseases will always be there. And when we invest in water and sanitation and hygiene, I'm sure we're also going to reduce diseases in this world. And this will be a healthy place for everyone to live. I'm Mary. I believe in clean water for better life for everyone. I stand up for change.
Saya Lia Apriana, seorang ibu rumah tangga yang bekerja membuat masker. Saya awalnya bekerja membuat kopiah, tas-tas lombok untuk pernikahan. Namun karena COVID-19, usaha saya tutup. Di awal COVID-19, masker menjadi barang langka. Waktu itu saya lihat tetangga warga terdekat kesulitan membeli masker. Saya dan suami saya membuat masker dari bahan seadanya, lalu saya bagikan secara gratis. Alhamdulillah ternyata kegiatan saya didengar oleh pemerintahan Kabupaten Lombok Barat dan saya diminta untuk memproduksi masker. Alhamdulillah, plan internasional datang meminta saya membawakan sebuah video kan untuk membuat masker transparan. Kita kerjasama dengan teman-teman, ternyata bisa saya membuat masker transparan.
Salah satu fokus dari Project WISE adalah mengangkat isu inklusif dan kami mengajak pengusaha masker untuk peduli pada penyandang disabilitas melalui inovasi masker transparan yang sangat berguna untuk teman-teman tuli.
Ya, saya mengkreasikan kain transparannya itu biar lebih besar dan agak ke depan biar tidak susah bernapas, biar kelihatan dengan gerak bibirnya.
Anak tunarungu kan tidak hanya berkomunikasi dengan anak tunarungu, jadi bisa komunikasi dengan teman-teman yang lainnya. Jadi komunikasi dua arahnya itu jalan gitu ya, melihat ekspresi satu sama lain. Mungkin bisa digunakan di sekolah, di lingkungan keluarga maupun di masyarakat luas.
Kami sangat mengapresiasi inovasi masker transparan dari Plan Indonesia dan pengusaha masker Kabupaten Lombok Barat. Hal ini merupakan bentuk penanganan pandemi COVID-19 yang inklusif sehingga penyandang disabilitas bisa beraktivitas dengan tetap menjalankan protokol kesehatan.
Untuk masker transparan saya ini, saya akan memperkenalkannya kepada orang-orang di desa, di pemerintahan, sekolah-sekolah, agar bisa digunakan oleh penyandang disabilitas.
I'm working for Fields Africa, Ethiopia program as Wash Alliance Project Manager, coordinating the projects, Wash CDG and Wash First COVID response projects. Now I'm going to give you a brief on how we have been reaching the most vulnerable remote communities through Wash First COVID-19 response project. As we all know that during the first occurrence of COVID-19 pandemic, there was poor community awareness on the transmission methods and preventive measures of COVID-19. But transmission was very high during that time even. The preparedness of the government was also very limited. That has forced the government to push NGOs and other civil society organizations to respond to the pandemic and support the government efforts. Accordingly, before we secured budget from AMREF Netherlands, we have repassed a few budget from WASH SDG development project and supported the government efforts in capacity building and supplying some personal protective equipment to some remote health facilities in the schools. After we secured a budget from AMREF Netherlands through WASH first COVID-19 project, we agreed with the local government on the intervention areas for WASH services, taking into account the vulnerability and remoteness of the community, and agreed on the selection criteria of the most vulnerable households, including with community leaders. And we have established the selection committees at the district and the community level also. And those selected households were also endorsed and verified by the user community to make sure that the right beneficiaries are included in the selection. In those selected communities and institutions, we have rehabilitated 3 water facilities which have been non-functional for the last almost 5 years and reached more than 40,000 beneficiaries in 3 rural communities with safe water for drinking and hand washing. And also we have strengthened WASH their management of these water facilities by re-establishing and capacitating water, sanitation, and hygiene committees. And also we have constructed roof water harvesting structures and hand washing facilities in more than 20 schools and health facilities in order to promote hand washing and make access for those communities water for drinking. We have also reached more than 500,000 people through awareness raising, using town criers and the local artists through local songs, through poem and the like. And we have also fixed more than 60 contact-free and pedal-operated hand washing facilities in health facilities, in schools, and even in prison. As you know, as one challenge during COVID intervention is that those households, vulnerable households especially, cannot afford for soap. In order to solve this problem locally, we have established 7 small and medium micro enterprises, youth micro enterprises, locally with the local government, and provided the skill training with nearby university on how to produce fluid soaps, sanitizer, and face masks. And we have supported those SME groups with startup materials and even chemicals. By now they are, then after they are licensed and they have their own stamp, receipt, and taxpayer identification number. They have now started producing and selling face masks, fluid soaps, and sanitizer, and they are selling to those vulnerable households, to shops, to health facilities at a reasonable price. And we have also distributed infection prevention and control materials, PPE, personal protective equipment, and non-food items to around 4,000 households, including people with disabilities, with women-headed households, with pregnant and lactating mother, for aged households, and the like. we can say that we are successful in implementing all these activities because our has a presence for more than 3 years in that area, and also we are working closely with government partners, including with religious leaders, with teachers, with health professionals, with community groups at all levels. And we have also strengthening coordination with those stakeholders at all levels, and the capacity building activities were also the major activities that created conducive environment for AMBEF to be successful. These are all what I have for today. Thank you very much.
Thank you very much for joining this session, and I do hope that you've been inspired by the stories that has been shared. In order to also get your inspiration and also your experience or reflection on what the stories that you have heard, you can either use the chat box to share your inspiration or your own stories, or you can go to the Mentimeter using menti.com with the code that is mentioned in this slide, or using the QR code that is presented. And if there are any questions, also, as I mentioned, the friends that whose stories have been shared, the champions, the shakers and movers have also joined us in this session. So if you would like to hear any more elaboration, please also mention it in the chat. I will now stop, and can we also have the link maybe in the chat? So I will stop sharing my my screen, and then my colleague would share her screen. So who have you, oh, sorry, that's a mistake. How have you moved or shake things during the pandemic? What actions have you taken during the pandemic for WASH? I will see if there are any questions or reflection on the so some of the reflections are that moved all of our trainings to an online format, reaching many more people than we would have otherwise been able to impact. Community people producing masks and distributing among the poor people. We have also did campaign and promotional activities to aware the people. We have changed from door to door to radio messages with community health workers answering questions during the radio shows, adapting to working online, especially in coordination of activities, sharing evidence-based info from reliable sources on how to prevent infection, Any more reflection? I think Mary is also online. If you would also like to add anything, please unmute yourself and do so, if I'm not mistaken. There are more replies through campaigns, applied adaptive planning and management to keep work going in uncertain circumstances. Very nice. Some of this goes a bit too quickly. Engage more stakeholders, religious leaders in spreading the gospel of COVID prevention and management, both on media and house to house. Great. I think it's also a reminder to all of us who in the past almost 2 years, 1.5 years, that we all have been able to take, even if it's not been much, but the sitting still has not been an option. So it's great to see that all of us have taken action for sharing with for having COVID contained, and sharing messages on COVID prevention through social media. That's also great. And launch a COVID-19 emergency response fund to help working animals and their owners to continue to access safe water. Very nice. Wonderful. And I think this also shows how the WASH community has played its role in taking up the pandemic. Now, I would like to take the opportunity, any of the colleagues or panel co-hosts, any of the friends who have been, who shared their stories. Leah, would you like to add something? We can, if you would like to add, I think would also be wonderful to hear from you. You don't have to. Can also say in Bahasa, and then we will hear later the translation. Okay, I see some more inputs are coming. Supported the WASH First colleagues in the countries to identify the stories of movers and shakers to inspire the world about courageous people in this COVID time. Okay, I would like to thank all of you for joining this session. It's been wonderful to have you. We will be stopped, I think, in a few seconds. I wish you a wonderful time during for the rest of the Stockholm World Water Week, and please continue your great work during the to reach the Sustainable Development Goals, actually, and not only for COVID-19. Ariette, anything from your side?
No, I just want to thank you, Sarah, for having you and for organizing and leading this session. And of course, it's great to see all the efforts that are done in the countries, and to be, and I think it's very good for all our awareness and also to learn from them. So a big thank you to everybody who played a role in this session. Thank you very much.
Yes, thank you. I would also want to mention all that we didn't mention all the great help and assistance and support that we had from other colleagues, including Sandra, Clarke, Breche, and also Brand Out Loud. And I think in addition, of course, the plant colleagues in Indonesia did a great job, and in Kenya, Patrick, SME colleagues, and also MRF colleagues from Ethiopia. So big thank to all of you, and enjoy your rest of the day, evening, afternoon.